So welcome everybody. I think this is our third week. So I'm Sarah, I'm the Chief Exec, and this is trying to use different means in which to communicate with as many people as possible. Obviously not being able to go out and see people in person is quite a challenge. This is very much me doing most of the talking. Use the chat function if there's any questions you want to ask, just because it's otherwise very difficult to try and manage a meeting of this size. But equally, keep any feedback that you've got coming via the coronavirus website, which Lucy and the team and the comms team are reviewing on a day-to-day basis. So that's our housekeeping for today. So these are just some of the symbols that hopefully you'll see out and about yourself, in which, whilst everyone is stuck indoors, the continued show of appreciation across the whole of the general public for workers, not just in the NHS, but our social care colleagues, people that are working in the care sector, and all those essential workers. That appreciation continues to be shown. And I just want staff to take a moment for reflection of yourselves. You're an important part of the vital workforce that is keeping things moving, that's looking after our most vulnerable. And whilst that might not mean at the moment being responsible for clinical caring for people with COVID, the huge amount of work that we're doing across our services to support our most vulnerable is absolutely phenomenal. So hopefully you'll have been seeing in the daily comms that we're sending out, but we've got so many examples of where you, our staff in every team and department across the organisation, are continuing to work extremely hard. Our priority as ever remains keeping everybody safe in terms of staff and service users. So we continue to have and encourage staff where possible to work remotely, not to be getting out and about. If your job means that you can work safely from home, please do. If you do need to be on our premises, maintaining the principles around social distancing, using the technology that we've got available to provide care in different ways to our service users. We know this week that we have relocated the A&E mental health support from St James's to the Becklin. This is really important because it's about making sure we maintain that service, but free up as much space in the A&E department as possible, as well as keep that separation between those that are clinically unwell, potentially turning up to A&E that are COVID positive. So a huge thank you. The support that everybody's giving to one another is really, really appreciated. Just so you also know as well, we've got a number of volunteers that have come forward that are all waiting in the wings, and where we think it's safe and appropriate to deploy them in supporting our frontline services, then they're more than willing to do that. So that's a huge amount of planning and preparation that's going on. So a huge thank you to all those volunteers that have come forward as well. And I just want to reiterate, just do what you can when you can. The important thing you can do is to keep yourself safe, to maintain those social distancing rules. The less people we have that are needing clinical treatment for the treatment of COVID, the better. This is going to be something that we are seeing those increases in terms of rates of infection, and the more we can do to prevent that is the best thing individually we can all do, regardless of our professional roles. Okay, so just to give you all some updates, again, these are always included in our daily comms and on the StaffNet sites. The PPE guidance was updated at the end of last week, and that has been shared across all of our services, which essentially now means that we are treating every interaction with a service user as if that service user potentially had COVID. And I'll go on to that a little bit more in a moment as to what that means. We've all been working really hard behind the scenes to push out the availability of testing for frontline staff, especially where staff are isolating because they've been in contact with somebody with COVID, or to get that early diagnostic test. There's a real challenge though. So as I've tried to explain there, the reality of the testing capacity that's been available is that for the whole of West Yorkshire, up until now, there's only been 150 tests per day. So I'm sure you'll agree with me, that's far from the capacity of testing that we need. We're hoping to see a rollout over the weekend, potentially from Sunday, is testing managed through an organisation called Deloitte. So this will be where staff can drive up, get a self-testing kit, complete that test, drop that off, and those results will come through. Those numbers are expected to increase, as are the routes that we've got through the lab at LTHT. The workforce team are members of the project group overseeing that for Leeds. So we'll send the communication out through the daily comms that gives people an update to where we're at with our access to those testing. Just to give an update as well, you'll have seen on the news about the opening of the Nightingale Hospital for Yorkshire and Humber that's going to be based in Harrogate, and work is underway 24 hours a day to complete the physical infrastructure of that. We've been contributing to that. So Peter Trigwell, who you know is the consultant for the National Inpatient Centre for Psychological Medicine, has volunteered, well, we asked him to and he didn't say no, to take a lead on coordinating what does the input need to look like, both to support the staff that are going to be working in that unit, but also to make sure that where patients in the Nightingale Hospital have mental health needs or they've got a learning disability, either pre-existing or that they develop mental health issues whilst they're there, that they get exactly the same level of support and treatment that we would want any of our loved ones to have, which is really important. So Peter's working hard on what that looks like with other colleagues. And we're just in the process of starting to go out across the mental health trusts in the region to look at how we put in place a rota to support. But just to be clear, the first cohort of patients that will be going in there will be patients from the acute trust that are requiring ventilation, not patients that are awake and mobile. So we're phasing it in line with what the clinical model is for the Harrogate Centre. There's guidelines out there on how all NHS staff needing accommodation can access it. We've got our own local procedure. Again, it's on the StaffNet site. We've got a number of staff now that are accessing that accommodation. I'll be honest, it's not been perfect. There are some teething problems to make sure that if you're using hotel accommodation, you get access to the right comforts and facilities that you would want if you were at home in terms of laundry, etc. So those issues have been shared back with the workforce team and they're working to resolve them. But if you or anybody you know in your teams would like access to accommodation in order that you don't want to be at home and exposed to people that are COVID positive or whatever those circumstances are, please do let us know. And you probably already know this for those where it's relevant. Schools are staying open in our region for key workers to provide much needed childcare for children. Okay, so where are we at within our trust? So as of today, we do have now 3 patients that have been confirmed as COVID positive. 2 patients are on the mount and we've got 1 in our specialist supported living service. They are being very, very well cared for. Their symptoms are not serious. They're being nursed in line with our infection prevention and control procedures. Staff have got all the equipment that they need and they're doing a fantastic job in continuing to provide that personalised individual care for those service users. And that's one thing I want to make sure we hold on to. A lot of what you hear in the press reporting is about the numbers and high level reporting of cases. These are people at the end of the day, and our importance is to make sure they get personalised care for them and that their families are well supported. So what this means, when I spoke to you last week, it was all about planning in the event of us having an outbreak of COVID. We're now in active case management. So a huge amount of on-the-day work to implement infection prevention procedures, cohorting and isolating of patients to make sure that we don't have the risk of spread to other patients in those areas. So all the work that you've all been involved in on getting those plans in place are now being mobilised. As I said on the previous slide, we now must treat every interaction with a patient as if they were potentially COVID positive. That requires us to wear gloves, aprons and masks in all inpatient interactions. What we are not, the only time you're required to wear the full length gowns and the FFP3 masks, if I remember the phrase rightly, is if what's described as an aerosol generating procedure. The only times at the moment we're aware that that would apply in our organisation is in relation to resuscitation of somebody should they enter cardiac arrest. It's not clear in relation to ECT, so we're taking the more cautious route to treat that as if it was an aerosol generating procedure and use the enhanced equipment. There aren't any other clinical interventions that we carry out at the moment in this trust that fall into that category. So that core requirement of gloves, mask and apron is sufficient to keep everybody safe. So far we've redeployed 23 staff, and a huge thanks to those that are working in different areas now to make sure that we've got priority services safely staffed. And just to confirm that tomorrow we will be moving the mother and baby unit out of the Mount into Parkside Lodge. Huge thank you to the clinical teams and a huge thank you to the estates and facilities team that have done a significant amount of work to make that happen. Those service users that were in Parkside Lodge being relocated to Woodland Square, with one going to another provider. So we're continuing to provide those services, just in different locations. So one of the things I wanted to reflect on as we're at another milestone in terms of responding to the pandemic is that it's new territory for all of us. Have I ever managed in the context of a global pandemic? No, none of us have. Have we got experience in managing major incidents, and have we been trained to managing major incidents? Yes, we have. It's just important to remind ourselves that our job has already required complex decision making, and all of those of you on the call involved in clinical services will get this day in, day out. It just feels as though it's a bit different when you're doing it in this kind of global scale of everybody working in a different way. And I just think it's important that we give ourselves a break sometimes. We're not expected to know all the answers. There is no plan that sets out exactly what we must do and the guarantee of the results that will produce. We're very much responding to the national guidance as things emerge in our own trust, the feedback that we get, and the plan we've got today is the plan we've got today. If we need to change that tomorrow, then absolutely we will change that tomorrow. And we're doing everything we can to make sure that through the different sources of communication, you've always got available the most up-to-date guidance and advice. So please, if ever you're in any doubt, go onto the website and see what the latest version of the guidance is that we're expecting people to follow. We're also setting up what's called an ethical advisory group. And this is recognising that in terms of how we normally provide our clinical services, that changes. So we are going to provide care to groups of patients that typically in the past we would have transferred into the acute trust. That can be challenging for our staff. We're redeploying staff to work in different teams. So how do we provide a safe space to explore what that means in terms of our decision making? If the changes to the Mental Health Act are enacted, that is a very different change in how we detain people. So again, those clinicians involved, it can cause you to ask questions, reflect on whether you're doing things in the way that you usually do and what that would mean in terms of your own professional governance. So Claire Kenwood's been leading on that, and again there's some further information going to be shared about routes to support, so that there's always somebody that we can contact for advice where ethical dilemmas would occur. And if there are anything that you do encounter, again the flowchart's going to be circulated. There is a route then to be able to contact those that sit on that ethical group to consider any case examples that you want to share and use that for wider learning for other people in the organisation. One of the things we've been talking about a lot is staff well-being and staff support. And I'll talk about what's on the slide in a moment. The first thing we have to remind ourselves is as human beings, we are hugely resilient and hugely adaptive. And in our own personal lives, as well as our professional lives, we've all built up through the course of our lifetime, tried and trusted ways of dealing with things when they get difficult. We need to remind ourselves that we've got those skills and we need to keep using them, so that we should always go to the things that we know make us feel safe, make us feel that we've got a safe space to talk things through, increasing our use of things like supervision, checking in when you're on duty as part of teams. So some of these do's and don'ts are what are coming from a national group looking at support for staff, and there's also what we're feeding into the support for the staff that'll be at the Nightingale Hospital. So let's make sure we continue to take our breaks and give ourselves that downtime, both for yourself and for those that you manage. We're not all very good at this, and especially when you're responsible for staff, the behaviour you display is the behaviour that you're advising your team is what is acceptable. So you, even if you're a manager of a team, you're entitled to time off, and it's important that you take time off because that encourages your staff to do so as well. Using your own social and peer support networks is hard at the moment. Normally when you physically see people, I don't know about you, but my family has now discovered house party to be able to have chats. I think we're probably talking more than we would do anyway, considering my family live on the other side of the Pennines. And we've got our closed staff Facebook group. Use it if you want to. It's not a requirement. People will go where they feel safe and comfortable to seek that support. If you're in an area where you've got inexperienced staff or you're being and you've got staff redeployed, buddy people up. Again, it's the same stuff that we do for new members of staff, students, people in the preceptorship. Buddy people up if they're in an area that they're not hugely familiar, in order to make people feel safe, that they've got somebody who can support them and somebody that they can check in with. And before you're going home, this is about the checking in and checking out. so that you're not going home dwelling on things that if you've had a particularly stressful shift. And just remember, we're all different. We'll all respond to things in a different way. And when we're under pressure, our preferences really play out. But there's also what we shouldn't do. So what we know, the evidence base is really strong, and certainly I had personal experience of this, of dealing with a number of major incidents when I worked in Cumbria, is that we don't force people to talk about the thoughts and feelings if they don't want to. And actually what we don't do is rush to offer things like formal psychological debriefs, psychological interventions, because the evidence is really clear. If you do that too soon, you actually cut across and undermine individuals' normal, habitual ways of coping with things. Only a very small number of people would go on after a major incident to require psychological support. So the first thing we do is normalise and reassure people to use those routes that they normally find comfortable. We're trying to feed that into our health and wellbeing offer, and all of the services that have always been available through Oki Health Support continue to be there. And for those staff that are self-isolating, we're just rolling out this week, keeping in touch phone calls, which is not anything more than at the moment, letting them know what's going on in the organisation, making sure that people have got any kit that they need, as a route in terms of advice, guidance, practical measures that we can take to people, and that to be a gateway if over a period of time people need more support. So finally, I think I've just talked about some of this, the support that we've got available to support people at work and at home. A reiteration, knowing that staff are working remotely, having everything on StaffNet is no use if you can't access it. So we're putting as much as we possibly can on our internet site so that you can access it from anywhere. And that we've added a new page on that for health and wellbeing. I'm going to reiterate, take your breaks, take your leave, log off from the systems if you can, switch that phone off when you're not on duty in order to look after yourself. And I'm immensely proud, continue to be immensely proud of the work that I am seeing across every single one of our teams of pulling together. For me, that's what makes the NHS what it is. At the end of the day, when things get tough, we pull together. We're no different here at LYPFT, and I'm just incredibly proud and incredibly grateful. But equally, look after yourselves. None of us are superhuman. Nobody's going to be the hero in any of this. This is about our collective endeavour to keep ourselves safe, our family members safe in everything that we do. So thank you very much. And that's it. So there's some more pictures that hopefully reiterate how fantastic everybody is. And if you've got anything that you want to add in terms of feedback to us that you think will help, that will make a difference, please just drop a note to that email inbox. And I'll just have a look now if there's anything that's come up on the chat whilst we've been talking. This has been recorded. Yes, it will be available. That we've started recording them last week and this week so that other people that haven't been able to join can watch. And the slides will be circulated as part of that as well. Okay, well, thank you very much, everybody. And I shall look forward to seeing you again next week for those of you that have made this part of your regular viewing calendar.